Hey guys, this is Dr. Samir Islam. I want to thank you for joining me tonight. And so today we're going to talk about a couple of things about obesity, and I'm going to start our lecture series on weight loss, obesity, what you can do, and kind of give you a rundown of what you could potentially do to help out with the obesity epidemic and what options you may have to help control some problems with obesity. And so I want to thank you guys for joining me, and let's begin. So, just a kind of a brief outline of the next couple of weeks, so the next couple of talks, we'll be discussing the problem of weight gain, what contributes to weight gain, why do people get fat, and then I'm going to focus a lot of the time these next couple of weeks on some of the things that we can do to help fix the obesity problem, whether it's diet and lifestyle, what works, what doesn't work, medications that are out there for weight loss, what procedures that I could potentially do. And what surgery can do for your weight loss problems. And I'm going to hopefully go through each one of these in the next couple of weeks. So let's begin for the two main questions, the problem of weight gain and what contributes to weight gain as well. And so there are a lot of medical problems that are attributed to weight gain, whether it's heartburn, reflux, GERD, fatty liver disease, IBS, colon cancer, and esophageal cancer. These are GI conditions that are very commonly associated with obesity, whether they cause these conditions to occur or whether they make these conditions more likely to be prevalent within yourself. So we know for a fact that those patients who are overweight, those patients who are obese, have a higher chance of having heartburn, have worsening reflux, and have a higher chance of going to esophageal cancer as well. We also know for a fact that patients who are obese have a higher chance of going into colon cancer. We also know that some of the treatments for heartburn, reflux, and IBS does include losing weight. And there are a lot of people who have problems with heartburn, and the most effective way to fix that without the need for medicines is to actually lose weight. But there are a lot of other non-GI condition or medical conditions that are also attributed to weight gain, whether it's high blood pressure, diabetes, arthritis problems, heart problems, including heart failure or heart attack, and other cancers that are not included within the GI tract. And so we know that obesity is a problem both within the GI field and within the non-GI field, leading to a lot of conditions such as knee pain, joint pain, and heart conditions as well. But there are a lot of other subtle things that a lot of people have when they are obese, and it doesn't include medical conditions. These can be some of the more emotional aspects when it comes to obesity. So, it's difficult to play with your kids if you're not able to run around with them, especially if you have young kids. It can be tiring to do normal things, whether it's walking to your car, or walking to a mailbox, or even going up a flight of stairs. This can be tiring for people who have to carry a lot of weight. Shopping for clothes can be difficult as well. They may not have the sizes that you need, or maybe you may have to go to multiple different stores to find the right clothes for you to wear. You can be embarrassed, or even be stereotyped because of the obesity problem you may have. And I've found that for a lot of our patients who come to see me for obesity, these are some of the reasons why they want to get the weight off. They want to be able to play with their kids, or they have young kids, and they want to be there for them. They have goals that they have in life, and they want to make sure they can reach those goals. And I find that a lot of my patients, these are the drivers to help them lose the weight that they want to lose, because they want to make sure that they're there for their loved ones, whether it's the long term or whether they can do things that they normally want to do with the people who they want to be with. And so within the United States, we know that it's a very pretty predominant health epidemic. Almost a third of the U.S. population is obese, and that number is getting larger and larger as the years come on. And specifically within Texas, almost a third of all Texans have obesity as an epidemic. And I'm sure that many of us have seen people who are around us who have the problem with obesity, and it's becoming more and more of an issue the more easier it is to get fast food and foods like that. So, as an introduction, there really are four key elements that contribute to weight loss, and one of them is the attitude. And it's important to have the right attitude when you want to lose the weight. It's if you're not optimistic about you losing the weight, or you're not optimistic or have a good attitude about wanting to lose weight, it can be very difficult. And the way you feel about your goals and your attitude towards weight plays a big difference in terms of whether we're able to achieve the weight loss goals that you want to do. Diet plays a big role as well, and it certainly plays a tremendous factor. And I would argue that diet probably has the most important role when it comes to weight gain and weight loss, and even exercise. It's very hard to lose the amount of calories that you need to lose in order to make up for the food that you eat. It's very easy to. It's a lot easier to change your diet and add exercise on top of that to get the weight gain that you want to do. And in these next couple of weeks, I'll be discussing about what particular diets do work and don't work. Exercise is also critically important, but like I mentioned before, in my opinion, diet plays a much important role and a more important role than exercise does. In fact, to lose about a pound of fat, you have to almost burn about 3,500 calories, which is a lot of calories to burn through exercise. Now, I'm not saying exercise is not important, it certainly is, but I would say that in the grand scheme of trying to lose weight, by far diet plays a huge role, though exercise is a very critical component of that. And lastly, lifestyle, how you live your life plays an important role with respect to weight gain and weight loss. If you're the type of person who who eats out all the time, or who is not aware of what you're eating, or you tend to have foods that are very high in ingredients or nutrients that are not good for you, you obviously are going to gain weight. Yet if you have a lifestyle in which you're realizing exactly what you're eating, you cook at home, use good habits to help maintain a healthy eating lifestyle, that's going to play a critical role with respect to how much weight you can lose. And so these four factors play a pretty significant role in making sure that you're able to lose the weight that you want to lose. So in summary, we know weight loss is weight is a significant problem here in the United States. It leads to multiple medical problems, both within the GI tract and the non-GI tract. And the four real main elements of weight loss include diet, exercise, attitude, and lifestyle. And by affecting those four components, we're able to maintain or have a significant improvement in helping people to lose the weight that they want to lose.